And the UK government has warned that there will be an increase in COVID-19 deaths in the coming weeks. This warning comes as England celebrated the lifting of nearly all COVID-19 restrictions after over a year. Scientists have said, however, that the number of deaths and hospitalizations will not be at the level seen in the previous waves. This is due to the high number of people who have already been vaccinated in the country.
We are seeing an increase in the number of deaths, but at a much, much lower level. But they again will continue to increase as infections increase and will be expected to reach over 100, possibly a lot over 100, but we'll see an increase in deaths over the next few weeks as the infections rise, but at a much lower level again because of the protection of vaccination.
Meanwhile, Prime Minister Boris Johnson said that he plans to make proof of double vaccination a condition of entry to nightclubs and other crowded venues from the end of September. This announcement comes after nightclubs opened on Monday at full capacity for the first time in 17 months. As cases surge across the country, Johnson announced that people who were not fully vaccinated would be barred from entering nightclubs. As Britain fully unlocks, scientists have forecast that it will soon have more daily new infections than it did in the previous wave earlier this year.
I don't want to have to close nightclubs again, as they have elsewhere. But it does mean nightclubs need to do the socially responsible thing and make use of the NHS COVID pass, which shows proof of vaccination, a recent negative test, or natural immunity as a means of entry. As we said last week, we do reserve the right to mandate certification at any point if it's necessary to reduce transmission. And I should serve notice now that by the end of September, when all over 18s will have had their chance to be double jabbed, we're planning to make full vaccination the condition of entry to nightclubs and other venues where large crowds gather.
On the vaccination front, the UK has decided against giving mass COVID-19 vaccinations to all children and said that they will only be offered in certain situations. Children with severe neurodisabilities, Down syndrome, immunosuppression and profound and multiple learning disabilities will be eligible for the vaccine in new guidance released by the government. The government said fewer than 30 children with the virus died in the United Kingdom up to March this year. Britain's decision is at odds with the countries such as the United States, where children over the age of 12 are being vaccinated.
Today's advice recommends that we continue to vaccinate 16, 17-year-olds who are in an at-risk group, as we do now. But it also recommends expanding the offer of the vaccine to some younger children with underlying health conditions that put them at greater risk of COVID-19. This includes children aged 12 to 15 with severe neurodisabilities, Down syndrome, immunosuppression and profound or multiple learning disabilities. The JCVI advises that we should offer the vaccine to all 17-year-olds who are within 3 months of their 18th birthday, so we can make sure they are protected as soon as they turn 18.
But as the country races to vaccinate its adult population, there are still people who do not believe in the vaccines. Anti-vaccination protesters demonstrated in front of the British Parliament on Monday, the day most COVID-19 restrictions were lifted. WION is now available in your country. Download the app now. Get all the news on the move.